Tēnā koutou katoa, e mihi ana ki anai tāhu, te iwi mana whenua o konei. Ko te pōkoko mataraka o, ko Stuart Brock. Tōku ingoa no reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. My name's Stuart Brock and I'm the Deputy Vice-Chancellor Academic. It's my great pleasure to welcome you to this very special occasion to celebrate the promotion of Dr. May to Professor at the University of Otago. These lectures are a highlight of my week, as I'm sure they are of yours too. They're a wonderful opportunity for us to come together and listen to our new professors talk about their professional journeys, their research platform, and the impact their research has had on others. I'd like to welcome colleagues, students and friends from across the university and beyond, including those joining us tonight by live stream. I'd also like to give a special welcome to Professor May's family, who are joining us tonight in the celebrations with May, including her husband Richard and two sons, Roger and Mark. It's not easy to become a professor at the University of Otago. In order to be promoted to that level, candidates need to show that they are outstanding in each of three areas: teaching, research and service. Professor May has clearly met all three of these criteria. It is an honour and a privilege for me to congratulate her tonight for this outstanding achievement, and I hope you'll join me now in doing the same. And I'd just like to say, if I wasn't holding this microphone, I would be clapping vigorously right now, so please encourage me. Thank you. Professor May is the Deputy Convener of the Bachelor of Dental Surgery at the University of Otago. Her research focuses on the effect of silver diamine fluoride on mineralised tissue, collagen and biofilms, and on the development of novel bioactive materials for caries management. In her IPL tonight, Professor May will tell us about her research on silver diamine fluoride, which has emerged as a minimally invasive, evidence-based treatment for dental caries, particularly among young children and underserved populations. Its clinical applications are broad, its application is painless, and it's proven to be very effective. As such, silver diamine fluoride has become a cornerstone of minimal invasive dentistry. In her lecture this evening, Professor May will share her research journey on silver diamine fluoride and bioactive materials, highlighting their combined impact on caries management. Tonight, though, Professor May will not only discuss her research. She will also reflect on her academic career, tell us a little bit about her personal journey and about the impact of her research on the profession, on her teaching, on her patients and on her students. But before she does that, I'll hand over to Professor Paul Cooper, Dean of the Faculty of Dentistry, to formally introduce Professor May and give you a little more detail about her personal and academic background.
Thank you, Stuart. Tēnā koutou katoa, and a warm welcome to everyone here in the auditorium and on Zoom. It is great to see so many people here today, this evening, to celebrate May's promotion and her lecture tonight. Ko Paul Cooper, toko ingoa, no ingarani oko tupuna, no otipoti aho. Kei te kaupaka punio aho, I mahi ana, he manutaki aho. I'm Paul Cooper and very proud to be Dean of this celebrated and historic Faculty of Dentistry. I'm originally from the UK, and it is my absolute honour and pleasure to introduce today's speaker for this inaugural professorial lecture, Professor May. May obtained her Bachelor of Dental Surgery degree in 2003 from Anhui Medical University, China. then received a Master of Dental Surgery from Nanjing Medical University in China in 2006. May then completed her PhD at the University of Hong Kong in 2010, which is one of the most prestigious and leading dental schools in the world. In 2016, May also undertook an exchange postdoctoral fellowship at the Edinburgh Dental Institute in the UK. We were fortunate to have May join us here at Otago in August 2019, having previously undertaken several academic roles at the Faculty of Dentistry, University of Hong Kong, where she still maintains close ties, including several research collaborations and an honorary associate professor position. May is a dedicated and expert academic clinician and professor in cariology. Her research is one of her major strengths. She has already successfully supervised 7 PhD students, and these students have won 11 international research awards, and as a result of her mentorship, this cohort has already published an impressive 30 research papers in high-impact journals. May is currently supervising 3 more PhD students as well as 2 declint dent students. To support her research, she has attracted significant prestigious funding of over $1 million from a wide range of funding bodies. She has too many collaborators from around the world for me to mention, and she has authored several book chapters relating to cariology, and she has published over 110 fully refereed scientific research articles. May's work has been recognised with numerous awards, also too many for me to mention. But to just highlight a few, these include highly prestigious International Association for Dental Research Awards, the 2020 Oral Biology Award from the Australia-New Zealand Division, which identifies excellence in the field of oral biology, the IADR Centennial Emerging Leaders Award in 2020, which recognises young investigators who will lead the research into the next century, and the Basil G. Bibby Young Investigator Award in 2019 from the IADR Cariology Research Group. May has had many teaching and coordination service roles in our faculty and has taught at all levels in both the BDS and BOH programs. Her student evaluations show she is a highly effective teacher who is well respected by her students, and it is great to see some of her students here today. Notably, she is currently our Deputy BDS Convener, and she has been a course director and a module coordinator over the years. May undertakes a large amount of service for the profession and is clearly a highly sought after invited speaker, examiner, reviewer and journal editor, both at the national and international levels. Indeed, I also have first-hand experience and know personally how diligently May undertakes her professional roles. It has been a pleasure to work alongside her in some of these societies. May has been an executive member of the Cariology Research Group of IADR, being vice president and president-elect, and she was full president from 2023 till 2024. She's been an executive member of the IADR ANZ division, being secretary from 2022 to 2025, and she's been an executive member of the IADR Asia Pacific region, being the treasurer in 2024. As a dean, I am extremely grateful for May's straightforward approach and considered advice that she provides. May supports many staff and students using her life experiences, hard work in her many roles in the faculty. I know May and her husband Richard are excellent photographers, and May has listed further awards on her CV, which include being the winner of the 2022 Otago Bulletin Board Photo Competition, with a photo being used for the 2023 University calendar, as well as the Oral Health Photo Contest Award at the Faculty of Dentistry, University of Hong Kong in 2019, with the photo being used for an oral health promotion poster on World Oral Health Day. I am therefore expecting that we will be in for a visual treat in some of May's slides. I know family means everything to May, and it's great to welcome her husband Richard and her 2 boys Roger and Mark here this evening. And I know she will also have family and friends who will watch the lecture from around the world and who will all be very proud. I am sure we're in for a very interesting and entertaining lecture, so please join me in welcoming Professor May to the lectern to give her IPL intriguingly titled From Prevention to Arrest, a Silver Bullet for Dental Caries Management. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Over to you.
Tēnā koutou katoa. ko Huangshan Timenga, ko Yangzi Tingawa, no Heina Aho, ko Mei Doko Fano, ko Lei Doko Imoa, ko Otago Doko Kura. Thank you, Deputy Vice Chancellor Professor Brooke and Dean Cooper for the kind introduction. Before I formally begin this lecture, I would like to express my gratitude to my colleagues and students from dental school and all the friends who are joining this tonight or joining online. Also thank my family and my husband, Richard Zheng Yang, and my two boys. Where are they? At the back. Yeah, be good, okay? Roger and Mark for being here. I'm very grateful you show up and support me for this very special occasion. So let's get started. This is a time machine, and let it take us to the beginning of my research story. So it was in year 2008. It was during Christmas in Hong Kong, and also at the end of my second year of PhD study. The whole city was filled with very festival atmosphere with beautiful decorated Christmas trees hung with the wishing cards. Here's my one. Co-authored with my roommate, who was also a PhD student in the Faculty of Science. It was written in Chinese, but the meaning was really simple. We wish to graduate on time. Yeah. Why I made this wish? Because I got some problem with my research. The same year, most of my time was spent in this very small room located at the 5th floor laboratory. If you look closely into the sign, it was written Artificial Mouse Research Laboratory, a very fancy name. Sounds like something like this. But actually, this is how it looks like. And you're right, the skinny lady in the picture was me. Those glass chambers, not sure whether you can see my, yeah. Those glass chambers are so-called artificial mouths. The nutrition will be provided through those tubes and drop into the chamber, and all this will be controlled by a computer program. And at that time, I was testing the whole equipment. At the time, the biggest problem I encountered was contamination. As some of you doing microbiology work, you can tell that contamination can found along the tubes and also from the color of the bacteria I grow, because I'm supposed to grow Caries bacteria, but all this bacteria, all this biofilm turns out to be Candida. Most likely, the contamination came from another research group that was working on Candida very near to my lab at the same time. Alan, who is the lab technician, he was very helpful. This picture just captures just one of the countless mornings we spent together. We tried to prepare the parts of the artificial mouth system and send them to autoclave. Autoclave is the sterilizing method used to disinfect the equipment. So contamination actually wasn't the only frustration I faced at that time. Even I could solve the contamination problem, all I really knew was I could only use this model system for my future research, but I had no idea what kind of research I'll be doing, to be honest. And to make the things even more uncertain, my research supervisor at that time was about to leave the university for some personal reason. Okay, so Dr. Zhu, who later on became a very important figure in my research journey, but at that time he was someone I barely knew. I still remember one ordinary day when he approached me to ask about the artificial mouth system. Unfortunately, I got somehow famous in the school because of my frustrations with it. So Dr. Zhu mentioned that given his decades of clinical experience and his project's clinical trial during his PhD research, he believed there was a game-changing solution for managing caries. He was wondering whether my artificial mouth system could be used to test this solution's effectiveness. It was the very first time I heard about this product, sulfadiamine fluoride. So let's have a bit of background of oral diseases and dental caries. As you can see from this table, oral diseases ranked the #1 common disease in all country income levels. And dental caries, as known as tooth decay, is one of the most common oral disease. So it refers to damage to the teeth caused by the bacteria, the biofilm in the mouth, and those bacteria turning the sugar into acid. And acid makes holes in your teeth eventually. If we leave it untreated, it will lead to pain, tooth loss, and infection. So some facts about dental caries. Actually, dental caries is mostly preventable. If you could keep a good oral hygiene status, you can brush your teeth well and have this routine visit to the dentist, it's highly preventable. But unfortunately, it's still very common. And it is a long-term condition and often linked to social and economic factors. Many people don't get the treatment because it's either too expensive for them or it's very hard for them to get access to routine dental care. And also, treating dental caries also costs a lot and places a heavy burden on the society. So these two photos shows you about the normal procedures, usually what we do as a dentist in our office to treat dental caries. So we need to remove the caries lesion, as known as the rotten tissue, and we repair it with the artificial materials. However, this drill and fill does not actually heal the disease. It just removes the rotten tissue. In addition, not everyone has access to the dental visit. Also, the cost is always a problem. So, sulfadiamine fluoride. So from now on, I will call it as SDF. In 2002, Dr. Zhu and his research supervisor, Professor Edward Low, they published a clinical trial which conducted in China and evaluated the use of SDF. Since its publication, this article has received more than 700 citations so far, and it is considered as a landmark paper in the field. So what did they do? In this clinical trial, they conducted in Guangzhou, which is a city very close to Hong Kong in China, and the study recruited a total of 375 children, which aged only from 3 to 5 years old from the kindergartens. And all these children have dentin caries. Dentin caries means some caries quite deep. It's already, you can already see there is holes on their teeth. On their upper incisors and canines, that means the front teeth. So they give annually application of the SDF together with the oral hygiene instructions. So after 13 months, 100% of the caries treated with SDF were healed. In contrast, fluoride varnish, another approach for managed caries, but mainly for prevention, achieved only about 15% arresting rate. There was no significant difference in the outcome when compared with the caries removal group and the non-caries removal group, which means you may not even need to remove the caries tissue. These two photos shows you a typical kindergarten outreach setting, the children lining up for examination and treatment. Because SDF is painless, so the children were quite relaxed. You still can see the smile on their faces. The procedure is very simple. We clean the caries surface, remove the biofilm, remove the plaque, then we apply the SDF solution with a small microbrush, and it's done. These two photos shows you how it looks like before and after treatment. Initially, if you could look closely, there are some caries lesions on the teeth, and they appeared yellowish. And if you touch it, it's quite soft. After SDF application, and it turns out to be black but hardened. Okay. Clinically, this hardening indicates that caries has been arrested and no longer progressing. Although SDF showed promising effect in arresting caries in their clinical trial, the mechanism, the reason why underlying was unclear. And there was very limited study at that time to look into this field. So back to the day when Dr. Zhu found me and talked about the artificial mouse system. So what we planned to do was to use artificial mouse system as the model system, and we want to investigate the mechanism of SDF. So let's look at this system again formally. As I just mentioned, those glass chambers are the so-called artificial mouse system, and the teeth specimen will be cut into standardized size and insert into the chamber. And the temperature of the chamber will be controlled at 37 degrees, just like the real situation. And all the artificial saliva and the nutrition will be supplied through these tubes and controlled by the computer program. And also the environment, we could use the gas tank to provide those anaerobic environment, which quite similar to the oral environment as well. We also improved the ways of disinfection and successfully cultured the Caries bacteria eventually. So this is the Caries bacteria. This system is still located in Hong Kong now, after several times of renovation, and the chance of contamination now is very low. This is the photo kindly taken by one of my previous colleagues, and he sent it to me last month. I'm very pleased to see the improvement. So back to the research. We successfully grow bacterial biofilm on the teeth in the system, and both biofilm on top of the biofilm and also the teeth were taken for assessment. We want to know what happens in the biofilm, in the bacteria, and what happens in the teeth. So this very nicely shaped necklace-like microgram are so-called Streptococcus mutans. Okay, so this observation is under about 14,000 magnification. They are considered as one of the most important cariogenic species because it can produce acid and also tolerate acid, therefore to destroy our teeth. After SDF applied on this bacteria, we found those very small nano-sized particles, and it was identified as sulfur. These two, again, beautiful images, shows you that the status of the bacteria. The green represent live cells, and the red represent the dead cells. So it's just corresponding to each of the image I showed before. So clearly, SDF killed most of the Streptococcus mutans. Similar result was observed when we tried to grow multiple bacteria together, which make it more like the real situation, as in our oral cavity, we have more than 700 species bacteria. SDF again showed a very significant inhibition effect on the bacterial growth. Regarding the tooth side, we found that the hardness of the caries lesion treated with SDF is significantly higher than the lesion without SDF treatment. When we look into the elemental change, it was due to the increase of amount of calcium and phosphate and minerals, so-called minerals, and again, which is consistent with the clinical findings of hardened surface. Given I only have 2 years left to complete my degree, if I want to graduate on time as I wished, I had been working very hard, almost living in the lab for quite a long time. But what motivated me most was that SDF did show a very promising effect, and I really become curious about how it works. In year 2009, I have presented my findings in the first IADR, which stands for International Association of Dental Research, in Asia Pacific region meeting, and was very fortunate to receive a travel award that sponsored me to attend the following year's IADR global meeting. So this is my supervisory group at that time. Next year, my very first time to being in Europe, Barcelona, and also the first time to attend IADR global meeting. The convention center was so huge, we were almost lost. I'm very deeply grateful to my supervisors for their support and encouragement throughout these challenging 2 years. And eventually, The wish I made in 2008 came true, and I graduated on time in year 2010. Graduation was not the end, but a new beginning. Without the pressure of meeting graduation deadlines, I could focus more freely on research, which was a great relief. The next question I set out was to explore deeper. I want to examine whether SDF altered the crystallization process of the dental tissue, the caries progression. And I want to look into the crystallization level. I also want to go a bit broader to see the microbiota change, because after all, as artificial mouth system is an in vitro system, it can only culture multiple bacteria, but it's still far away from the real situation. In 2016, I got a visiting scholarship which sponsored by the government to have a 3 months visiting to a Scottish university. I chose University of Edinburgh because the president of the IADR at that time, Professor Angus Worth, was the director of the Dental Institute. And most importantly, one of his collaborators, Dr. Fabio Naduman, who is a chemist and expert in the biomimetic mineralization, is also in Edinburgh. I still remember when Angus first met me and he asked me which discipline I want to visit for some clinical work. And I told him I want to go to chemistry department. I spent 3 months in chemistry department with Fabio's small but productive research team, Bart and Jessica. We developed an in vitro chemical model to stimulate the crystallization process in oral environment. And after tons of hours spending in the laboratory, I finally managed to purify the product when SDF react with hydroxyapatite. And also, I have learned a lot of advanced technologies by spending time with their lab. We established a very good collaboration along the years since then, and the time we spent with them was a treasure in my life. So in the simplified chemical model we developed, we were able to observe the changes at the crystal level following SDF treatment. The image on the right shows you the fluoride hydroxyapatite, the reaction product formed in SDF-treated teeth. This structure is clearly different from the normal calcium phosphate, and this structure is also more resistant to acid compared with the normal calcium phosphate, so therefore providing the further explanation for the clinical success of SDF. During these 3 months in Edinburgh, I also got time to further explore my photography skills. I carry my camera with me everywhere. So those are the photos I got. The one in the middle actually was taken during the Mid-Autumn Festival. This festival is the second most important festival for Chinese families to reunite. And actually yesterday was this festival. And at that moment, I was missing home very much. So I captured the moon and I paired it with a Chinese poem to express my feelings. At that time, I had no idea that Dunedin, often called the Edinburgh of the South, would later on become part of my life journey. Output of this 3 months work, we published our findings and suggested that SDF actually, it's very small letters, actually SDF react with calcium phosphate ions and produced fluoride hydroxyapatite. And this preferential precipitation of fluoride hydroxyapatite with the reduced solubility could be one of the main factors for the arrest of the caries lesion treated with SDF. Hi, Hassel. These are the TM images I captured for the fluoride hydroxyapatite, which I turned it into emoji, because I feel like it looks like an animal with a small tail. On the other hand, we wanted to know whether SDF will alter the microbiota of the oral biofilm, as I mentioned before, because artificial mouth system is, after all, is not a real one. Thankfully, I was working in a very big group, which was doing clinical trials at the same time. we managed to collect the plaque from the caries lesion and before and after the SDF application. So what we found was SDF actually did not alter the overall diversity of the bacterial community. However, pathogenic species, which are the bad ones, were reduced in the successful cases, whereas they increased in the failure cases. However, this study has certain limitations, like the small sample size and the short observation time. I'm very glad that this part of the study now is still ongoing under one of my previous colleagues, Dr. Oli Yu in Hong Kong, and they have already made significant progress on this side. So from the clinical aspect, these are the factors that affect the successful rate of SDF. First, the front teeth. The teeth at the front has a higher successful rate compared with the teeth at the back because they're more easy to be cleaned. And outside, inside, which means outside, inside of the teeth, which have a higher successful rate when compared with the chewing surface and the surface adjacent to each other. Again, this is much to do with how easy they can be cleaned. And most importantly, the lesion with plaque has a lower, okay, the lesion without plaque, let's put in a positive way. The lesion with no plaque accumulation has a much higher successful rate with the lesion with the plaque. And this indicates that the patient with good oral hygiene, not only the patient, every one of us, with good oral hygiene will have a much more higher successful rate when compared with those with poor oral hygiene. So in 2018, we brought together years of findings and published another review on SDF, which marking an important milestone in our research journey. In very brief summary, sulfur acts with bacterial cell membranes and bacterial enzymes, which can inhibit bacterial growth. And fluoride enhances the mineral formation by forming the fluoride hydroxyapatite with reduced solubility. And this combination of sulfur and fluoride in an alkaline solution also has a synergistic effect, which in arresting caries, because the alkaline property will provide an unfavorable environment for the enzymes to destroy the collagen. Along the way, I was fortunate to receive several prestigious awards for my work on SDF. Looking back, I feel really lucky to have caught a wave of SDF at the right time. Thanks to my supervisors and the supportive platform I was given. Even after years of studying SDF, actually, I still find that there are so many aspects we cannot fully understand, reminding me that how small we are as human beings. That said, it is now time to move forward. Given the painless, simple, and cost-effective, non-invasive nature of SDF, it has become an important treatment for dental caries, particularly in underserved groups, rural and remote communities, children and elderly. The ultimate goal of our research should be to contribute meaningfully to the society. Along the years, I got opportunities to participate in outreach programs. We visited rural villages, as you can see from the photo, and even the farmer's home. We're working under very basic lighting conditions and providing treatment using SDF, fluoride varnish, glass iodomer cement, all these minimally invasive ways to provide the treatment. We also visited schools where we not only treat the children, but also taught them what is caries, how to prevent caries, how to brush their teeth properly, which helping to promote better oral health awareness. These photos also capture some wonderful memories. We set up examinations area in primary schools, like you can see from here, very simply putting all the desks together and using portable equipment to sterilize the instrument. Sometimes our fingers were stained by SDF, and the marks would take about 10 days to fade. And we also took opportunities to educate the parents and the teachers in the kindergarten as well about how important to maintain a good oral health. A diverse group of team members who have passion to serve participated in this along the years program, including dentists, academics, postgraduates, and undergraduate students. In the most recent World Health Organization Global Oral Health Policy, the establishment of a new section dedicated to dental preparations marked an important step in addressing the global burden of dental caries and oral health inequities. As part of this development, sulfadiamine fluoride was the first time included in the dental section of the WHO model list of essential medicine in 2021, a list that serves as a guide for more than 100 countries. I'm very delighted to share that SDF now is available in Aotearoa, New Zealand as well, thanks to the collaborative effect of a group of dedicated dental professionals. National guidelines for its use now is available, developed and available. I sincerely hope SDF can bring benefits to many more people across New Zealand. So building on my years of work with SDF, my current research mainly falls into the following areas. As you may already notice, SDF causes very obvious staining on the teeth. So we were thinking whether there are alternative ways to manage the staining, reduce the staining. So that's why part of my, previous research work was focusing on the sulfur, to develop some sulfur nanoparticles. And the SDF release both sulfur and fluoride into the oral environment and heal the caries. So in a way, it is called bioactive. So we are very interested in all these bioactive activities materials, so which including the biomineralization, the bioactive glass, which can also treat for dentin hypersensitivity or caries, and all the peptides, and also those available bioactive restorative materials as well. And how about the conjunctive use of SDF with other dental treatment? So we also investigate those conjunctive use effect of together with either fluoride varnish or other dental fillings. And we also look into different clinical scenarios, like how SDF will affect the bonding of the dental fillings, and what will be the pulp response from the, if you apply SDF on the very deep caries, which are very close to the pulp. And how about the dry mouth? Because the saliva being reduced, whether SDF will be as same effective as possible. And given all these situations, we are also quite interested in establish different modeling systems to represent different clinical scenarios. So just want to share some of our postgraduate student research. So Dr. Iris, she's already graduate. Now she's an assistant professor in Hong Kong already, but she started her PhD as developing sulfur nanoparticles. And this now is still part of her research direction. I want to highlight that one of her literature reviews, actually it's a very common topic, but we want her to do this, she wants to do this review because she wants to know broadly what's happening in this field. And it turns out to have a very high citation. So in 6 years, it got more than 100 citations. And she's now one of the world's top 2 scientists, and I'm very proud of her. Some clinical scenarios of SDF application. Deep caries, one of our current declinant students, Adam, he's working on this area, and he already published a literature review on it, and he wants to see how the pulp responds to the SDF in their very deep caries scenarios. And Belinda, one of our previous honorary students, her project, we developed a reduced saliva chemical modeling system for her project because we want to see in those kind of environment situation whether SDF still is effective or not. And another two wonderful elective students, Sonia and Yankang, their project focused on whether the SDF application will affect the bonding strength of the dental fillings. Some bioactive materials, we want to explore all the possibilities. So Professor Li, he's in China. He's one of my mentors in the biomimetic mineralization, and we are still collaborating and co-supervising PhD students nowadays. So he just got me all through all these possibilities of mineralization, and he's a wonderful periodontist as well as a materials scientist. I learned a lot from him. And another PhD student, she already graduated, Dr. Doreen Day. Her project was on the mechanism of bioactive glass. And now she's developing some new bioactive glass for caries management, which I'm also quite proud of her. And just highlight one of our elective students, Caries. Caries was very brave. She wanted to do a really nice project with us. Actually, this project is already at the master level, but she's very dedicated. And she spent a lot of time in the lab. And eventually, her project is on some bio-inspired peptides, self-assembling peptides, and the effect together with the fluoride varnish. And eventually, we managed to publish her research in Caries research. So we always say Caries research in Caries research. Yeah, and another possibility is the peptides. I've become quite interested in peptides about 5 or 6 years ago. Yeah, we have a series of antimicrobial peptides project ongoing. So Dr. John Niu, his project is something like we want to graft a tooth-targeted function to the normal antimicrobial peptide and make it more specific to the dental use. And one of our current students, Yvonne, her project is more specific, not only targeting the tooth, but also targeting the pathogenic bacteria as mutants, the necklace you just saw. Yeah. So another one becomes smarter because when the caries happened, the environmental pH actually dropped. The whole environment become quite acidic. So if we could have peptides only respond when the pH drops, that product will be quite smart because it will be no harm when the nutrition or when the pH is still neutral. Okay, it will only detect the signals when the pH drops. So Dr. Dina, our postdoc fellow from our dental school, she's working on this aspect. Some clinical implications, we do notice that there are quite a number of different bioactive materials available in the market, and we try to restore the teeth with different restorative bioactive material and give it different scenario by adjusting our in vitro models and see how it works. So this part of the work basically done by our elective students, very wonderful undergraduates, Joish, Fika, Estra, and Deborah. So they've done a wonderful job on this part of the study. And one of our declinant student, Nina. Nina's work is also on the bioactive restorative materials, and two PhD students, Isha and Tia, they try to develop something new. Yeah. All right. So the story started from 2008, but it's still ongoing. It's not the end. But when I look back, as a dental professionals, what we should really keep in mind is tooth decay should be treated as a disease rather than infected tissue. We should still aiming to heal it. The contemporary caries management philosophy has changed. It's no longer the traditional surgical approach. Now we focus on the medical approach. So medical approach will focus on the preventive ways rather than just drill and fill. So dietary analysis, oral hygiene instructions, which our students are very good at this, and fissure sealant, those chewing gum, antimicrobial agents, and fluoride therapies, all this we should bear in mind as our dental daily practice for the prevention of the dental caries. All right, acknowledgement. On my Scopus research profile, I have 137 co-authors listed. That may not seem like a very huge number compared to many academics, but I truly cherish every single journey we have shared. Some of the co-authors have already become my lifelong friends, and I'm deeply grateful to my mentors, colleagues, collaborators, and my postgraduate students for their time, effort, and dedication. None of these achievements would be possible without you. Thanks also goes to my undergraduate students who undertook the elective projects with me, which is a very special experience here in Otago. They probably knew already from the start that working with our team would not be easy, requiring long hours and strong commitment in the lab. I truly appreciate their passion for research, their dedication, and their reliability. Also, a big thank you to Casey and Manny, my team member, for your friendship all over the years, and also standing by me always. Teaching. To Lara and Ben, thank you for your great leadership and constant support and prompt responses always. Suzanne's encouragement during the handover of the convener roles meant a lot to us. And Colin, Abdullah, and Paul, I will always remember your kindness and help when I first arrived at Otago and had no idea what I was doing. To my dear 261 colleagues, Andrew, thank you for working with me on this paper for 6 years, yes. And Zena, I'm so glad to see how well you managed 261 now. And Chitra, thank you so much for being so reliable and sharing the burden with me. And Alex, sorry, I couldn't find a photo for Alex, but yeah, I'm too shy to ask for one. But Alex, thank you so much for your work for the PROS Lab. To my dear BDS3 colleagues, I see you've done a fantastic job for 361, and Simon and Jonathan for looking after 362 and 363 so well. So this is my first time as a BDS3 year chair. You truly make my life easier. Finally, a big thank you to my BDS committee for the positive way we support each other. Thank you for always, admin team, thank you so much for always being there, behind the scenes and keep everything run so smoothly. I stole this photo from the Floors and Fitness group. I hope I didn't miss anyone. And we couldn't do anything without you. Yeah, thank you so much. And teaching simulation is my second home when I arrived Otago. I began teaching in simulation since 2021. When Jacqueline and Jill were still there with us, we had such a wonderful time together in Children's Pavilion. In 2021, we moved back to our new dental building. With the start of COVID, that's why we were all wearing masks. In 2022, Natalie started joining us and looking after us. Thank you, Natalie, for your care and support all over the years. In 2023, we optimized the location. We stepped outside and take this group photo. 2024, gather again. Miss you, Sunil. I hope you are doing well in Australia. And 2025, this one is very recent photo, was just taken last week. My thanks also goes to all the tutors, of course, also to my students. Especially to my students, thank you for bearing with my English. And I enjoy the time we spend together. Teaching you has made me a better person with better English. As someone has a shy nature, it is not easy for me to make new friends. That make me very cherish my old friendship, even especially for those who have been with me for over 10 years. Also, we are now scattered across the world, and we don't see each other that often, but thanks to the modern technology, I still can talk to them whenever I want. They still remain my true comfort zone. I'm also deeply grateful to my church, my brothers and sisters in my fellowship group, whose love and support have strengthened my faith. Finally, my family. To my parents, they're happily enjoying their retirement at a hometown in China. And also to my dearest uncle, who is in heaven now. But I'm really grateful for his guidance from my very young age, for the love of science. I miss him every day. My Wave family. I would like to thank Richard for giving up everything he once had and finding the courage to begin a brand new life with me in New Zealand. And my 2 boys, thank you for being here listening to Mommy. And even I don't think you have other choices. All right, thank you once again, everyone, for coming tonight. I really appreciate your attendance tonight. I wish you all a wonderful evening. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you very much.
Ngā mihi. Oh, thank you so much. What an amazing journey. I think I sort of prepared some things, but I've actually been blown away by your whole story, the journey, the passion, and you know, I know some of that science. I've been there with some contaminations and that frustrations, and it points to your dogged, determinate ability to problem solve, to work with team players, and you've got amazing results. And what I loved about the presentation, it's not just about the research, it's the collaboration with everybody. The students clearly love you. I have the honor of reading some of these reports, and it's often, Professor May is amazing. Couldn't do it without her. The supportive, nurturing environment you give. Now we've got all these years of these health professionals coming through, and they're really, really well trained because of you. An amazing, amazing, amazing job. Also, just that whole thing about being at the forefront. I think you just put up a slide. It's now been introduced into New Zealand, and a big part of that is you and the research that you have done, and this is going to impact a lot of our population, and is really, you know, life-changing for a lot of people. It's either that or extraction, and seeing some of these poor young children have lots and lots of extractions, and to have something that's a game changer is a really significant thing. I also appreciate the fact that all the history that you've done, all that hard work during your PhD and the postdoc, we are the benefit, our students are the benefit, and you've got next generation of outstanding researchers, and a big thanks to you. I was a bit worried when you came to join us in August 2019. I think it was very, very, very cold, and I saw your young family, and I must admit, I thought, how long are you going to be with us for? But I just love the way you've integrated so well with us, your community, with the church, and I'm really glad that you are with us. We are the benefit of that, so thank you for that. I don't need to say anything more. We've heard what an amazing life journey that you've had, and a well deserved professorial appointment, so congratulations. We have a very small gift on behalf of the university, which I will present to you. So thank you very much. So a big thanks to everybody who was online, and to you, the audience here as well. I thank you for coming and joining with us in this lovely celebration. And as a nice thing, if you would like to join us, the academic party afterwards at the staff club, that would be wonderful. We hope that you can spend some time with us, enjoy that time, and enjoy some time with Professor May. So thank you very much. Thank you. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Good evening.